Hi, welcome to the GOAT podcast, where we discuss health, integrative health, exercise, and well being. Our guest today is Dr. Dillon, a chiropractor who comes all the way from South Africa to Bahrain, actually, one of the leading chiropractors in Bahrain, and I think in the region as well. Welcome to the podcast.
Well, thank you very much for that fantastic intro. Yeah, I'm Dr. Dillon. I was saying earlier on that I watch a lot of Joe Rogan.
Well,
So just being here actually excites me a lot for that whole experience of being on a podcast and just getting ideas thrown about, having an opportunity and an avenue to discuss health, wellness, and all the other related well-being aspects.
right.
So, yeah, thank you for having me.
Thank you for coming here. So, can you just let us know what is chiropractor adjustment simplified?
Yeah. So chiropractic itself is I'm going to say a pretty recent innovation in medicine. When I say recent, I mean in a sense of just recently has it become a little bit more common in its practice. I think with the advent of social media, it's exploded the idea of chiropractic and what our benefits and uses of chiropractic. But in essence, chiropractic has mostly been about the chiropractic adjustment, which is pretty much the clicking of the spine
Right.
or joints.
Right.
This is pretty much the bare bones of chiropractic, is the adjustments.
Right.
But again, as science has continued to develop, chiropractic has also developed. And we now have a situation where chiropractors are not only just using the adjustments, but are using other modalities to try and help patients
Right.
when it comes to musculoskeletal issues,
Right.
well-being, and performance.
Right.
Something that's obviously very, very strong with me
Yes.
is the science and the evidence behind applying chiropractic principles with modern medicine to help performance in sports.
That's really, really inspiring, actually. And what inspired you to become a chiropractor? And you
Oh,
are actually specialized in sports and medicine science, right?
yes, yes.
Yeah.
Oh, I'm going to get nice and soppy right now. So, what inspired me was actually when we kids, we all say, what do you want to do when you grow up? Or what you want to be when you grow up? I want to be a pilot. I want to be a policeman. I want to be a fireman. I was fortunate enough to say, I want to be a chiropractor,
Oh, wow.
which is weird, yes. But what happened was my mum was struggling with some neck pain and she was told she needs surgery. That's the be all end all. She needs surgery to help. And I clearly remember going to the hospital to see her on traction and just, being stuck in the hospital on traction constantly to try
Right.
and help with the neck pain.
Yeah.
Eventually, one of her colleagues said to her, why don't you go and try this chiropractic thing?
Yeah.
And again, back in South Africa back then, I mean, this was early 90s. Gee.
Wasn't this so still new?
Yeah, well, this is it. This was early 90s when
Right.
nobody really even knew about it. Even in South Africa, we didn't really
Right.
know about it. It was still, I'm not saying hidden, but, it just wasn't very well known.
Do you think it's hidden because it's a part of kind of holistic healing or holistic approach to?
I
Okay, you don't have to answer that. It's fine.
I don't want to really go down that route.
No, it's fine. Let's go back to the story.
Yeah. No, but just to add to that,
Yeah.
what I will say is that now with the advent of social media, if that was the case, well, now it's not.
It's not anymore.
Yeah, because now voices are being heard everywhere.
Yes, absolutely.
So now you can, of course, see the applicability of what we do for
Right.
patients. And again, depending on chiropractor to chiropractor, you can see the science that's involved and
Yeah.
how those chiropractors are using it. But yeah, to go back to the story was that my mom was told, go see this guy, he's a chiropractor.
Yeah.
And I was with mom and we went to see the chiropractor. And lo and behold, today she still hasn't had the surgery. I'm not saying that mom is pain-free. Mom still struggles with a bit of neck pain.
Yes.
I try and help where I can, but she hasn't had the surgery. And for me, that's one of the big things. Once you cut, you can't uncut.
Yes.
Of course, there are situations where I will even tell patients, stop what you're doing. You need surgery. This is who or where I recommend we go.
Right.
And we push the patients towards that. But it's not necessary for every situation.
Yeah.
And my mom's situation was a perfect example where it worked.
Right.
And again, it may have worked for mom, but let's say mom had a twin sister and she had the same problem. Maybe it wouldn't have worked for her.
Yeah, definitely.
So, and this is it. I was chatting to one of my colleagues the other day, and I said to them, I know it's a tough pill to swallow, but medicine is a very educated guess when we try to help patients. It's using, obviously, science,
yes,
but it's an educated guess at what a diagnosis could be. And then we work from there in a trial and error in some cases. Yeah. In other cases, of course, if you fall and your arm is split into parts, of course it's broken.
Yes, of course, it's a little bit different. Then. Yeah.
But for low back pain, a lot of the time it's educated guessing. To try and understand where or what the problem is. So this is where it landed me. I was watching mum improve in her function and daily living, and I said to mum, well, that's what I want to do.
That's amazing.
Living the dream.
It makes more sense now. Yeah. And don't people mistake you for a physiotherapist, especially here in Bahrain, because it's still not really known what a chiropractor is.
I'd
say maybe 40% of population know what you do.
40 is a bit of a reach. I think probably less than that.
Less? Okay.
Yeah, no, it's still relatively new. I mean, look, I've been in Bahrain now for 8 years. I was one of the first few chiropractors on the island.
Right.
And even up to now, I'm just going to quickly in my head do some math and say maybe 6 or 7 chiropractors on the island.
Right. Yeah.
Yeah.
I think so too.
That's it. Yeah. You go to Dubai. I mean, I'm not even going to start counting. Numbers are crazy. So in Bahrain itself, it's still relatively new. And in Saudi, I mean, I can offhand think of 2 clinics. I don't know how many chiropractors in Saudi.
Yeah, I never heard of anyone. Actually, because they usually come to Bahrain for that.
And this is it. Most patients from Saudi are coming to Bahrain. 70% of my patients are from Saudi. So how much bigger is Saudi compared to just baby little Bahrain?
Right.
Absolutely. And there it's growing in stature in terms of chiropractic. People are becoming a lot more aware. Between Saudi and Bahrain, it's growing slowly, but a very small population still knows what it is.
What do they usually come to see for? I'm talking about general public now.
Yeah. Going back to your question about the chiropractic and physical therapy is, again, if we look at the science, chiropractic and physical therapy are very similar in their outcomes and what patients are expecting. How we go about doing that is therapist, doctor dependent.
Yes.
Again, chiropractic started off as being purely the adjustments, the spinal manipulation. Physical therapy initially didn't really involve that. But you can have physical therapists now go for post-grad courses on learning how to do spinal manipulation. So incorporating a bit of chiropractic care.
Yes, I've actually seen that. Don't people usually mistake you for being a physiotherapist, since not many people know what you actually do or what chiropractors are here in the region? Or in Bahrain, let's say.
That's actually a very common issue that we have, where patients will ask me, so what's the difference between you and a physiotherapist? And I think lines have become very blurred recently with the application of science and evidence-based medicine. So if you look just at the bare bones again, chiropractic was originally just about the adjustment, the
Yeah.
spinal manipulation. Physiotherapists, it wasn't. But today, as a physiotherapist, you can go and do a postgrad course on spinal manipulation. In essence, borrowing attributes that a chiropractor would use. And the same thing with chiropractors. I mean, I'm a perfect example of this. I incorporate a lot of soft tissue work, electromodalities, strength and conditioning
Yes.
with my treatment. I'm not just one of those chiropractors who's clicking.
Yeah, I was surprised to see that as well.
Yeah.
And to see a little bit of corrective exercises and adding a little bit of strength
Yeah.
training, like after the.
Yeah. And again, this is the misconception that people think this chiropractors only click.
Yeah.
And unfortunately, again, with social media, there's a lot of clickbait out there. And, I mean, the common one, I don't even want to talk about it, but the ring dinger that,
Oh, yes. Yes. I see that a lot.
Honestly, guys, please don't do it.
Yeah.
It's no.
And, also I like see some kids trying to do it as well.
Oh, dear. Yeah, well, there you go. Yeah, there you go.
And they're just trying to get that sound, right?
Yeah.
On camera.
I mean, I'm a chiropractor myself, and if you say, hey, you want to do the ring ding on me, I'm going to say, no, thank you. I'll find another avenue.
Of course.
I mean, just some of the videos that I see, the amount of discomfort that the patient goes through that adjustment itself. Yes, maybe at the end it might feel good. I don't know.
Yeah.
But just what I see there and then, they're screaming. Why would I want you as a patient to go through that?
Usually there's no pain.
Oh, this is it. This is
You'll
it.
probably feel a bit weird, uncomfortable after that, but that's your body's trying
20
to...
seconds?
Yes.
Yeah. At most, and it's not going to be one of those screams.
Yeah.
It's just going to be like, okay, I didn't expect that sort of sensation.
Yeah.
But not that. And just, it's just not a very safe method, in my opinion, and in the opinion of the research.
Yes.
A long axis distraction to that velocity and amplitude. No, there's no research to show that is effective. So again, from a chiropractic standpoint, the way in which I'm doing things, I'm trying to incorporate a lot of science in what I do, a lot of research in what I do. And I think chiropractors who are applying pure chiropractic adjustments without, when I say the bells and whistles, I shouldn't say that because it's not really bells and whistles, but without applying the science, which is the rehabilitation, the muscle strengthening, the conditioning. Without applying that, you're selling your patient short.
So many chiropractors, let's say, or I don't know if it's the majority actually, do they actually educate their patients that there's a lot of work to do after the adjustment? And is there?
Yes. Okay, that I will give kudos there, is that most chiropractors are offering advice on, or patient education on corrective exercise. My discussion with a patient the other day was, when patients come in to see me, they have an idea that they're coming to see me to be adjusted or to have some sort of treatment per se. And what I tried to explain to the patient the other day, which actually sort of made sense in my mind, was actually that's not my job. My job, yes, is to make you feel better. But how do I do that? It's actually to give you confidence. It's to build your confidence up. Yes. Yesterday was a prime example. I had a patient who said to me, I've got a lower back disc issue and I can't lift weights. And I was told that I shouldn't go to the gym. And what I said to him was perfect. Okay, I have lower back pain when I walk. Are you going to tell me, Dillon, don't ever walk again?
Right.
I'm sorry. The logic is absolutely flawed.
It's absolutely not there.
Yeah.
I don't see it. Doesn't make sense. And also, I don't know. It's just weird for me because of my background and what I do.
Exactly.
People come to me with different like types of like pains, and especially like lower back and knee pain and stuff like that. And honestly, throughout these years, I've learned how to activate certain muscles and to do some adjustments to like help them
So you're modifying.
Exactly.
You're modifying, but you're not
Yes.
stopping.
No.
Well, this is it.
But I'm not training them the same as, let's say, an athlete who has no injuries or.
Again, modification is
Yeah.
key.
100%.
It's key. And this is what people fail to realize. I have patients coming in saying to me, my trainer or my doctor or my therapist told me not to deadlift, not to squat. My question is always, why? Why are you told not to do these movements? I'm sorry, show me the research
Yes.
that says it shouldn't be done. And I will obviously change my tune. But right now, there's no research to show that that is the problem. Or for that matter, a patient who will say from themselves, I was deadlifting, I hurt my back, deadlifts are bad for you. Deadlifts aren't bad for you.
Yeah.
It's how much you've put into the exercise. Maybe the problem is you've been deadlifting 5 days this week.
Yes.
You've now overloaded. Maybe that's the problem. Yeah. Maybe you've seen your cousin deadlift 150 kilograms, and you, who's never deadlifted before, has decided, I want to be like my cousin.
Yeah, and that's what you usually see.
Yeah.
And that's what I'm against in the gym.
Yeah.
And also, the feeling of not lifting heavy doesn't give them that satisfaction that they actually worked out.
Yeah.
Right? And this is very, very, very wrong. And I learned it the hard way myself. But yeah, it doesn't make, to me, it doesn't make sense. It made sense one day, but doesn't anymore. And I hope.
And again, I can talk about, patient situations. For example, today I had a patient come in and she says to me that she's quite active here in Bahrain in terms of doing a lot of road running. But for the last month, she's been in Europe where, listen, we've been in summer. It's difficult to be outside here in Bahrain.
Yeah.
So she's just been indoors road running on the treadmill.
Right.
Now she's been in Europe for the last month. She's been running outdoors, as well as including a lot of hiking through the mountains.
Right.
And now her back has played up. Why is this the case? Listen, I'm not a magician to just know why this is the case, but let's just do the math. Okay, here in Bahrain, before you left, you were doing, let's, for argument's sake, say 5 kilometers a day running on the treadmill. Now you're doing 5 kilometers of road running in Europe every day, as well as an additional 5 kilometers of hiking, which you never did before.
Yeah.
And this is every day. Do you not see how it's not the running that's the problem? It's you've overloaded, or you've just gone way too much, too quickly, without a very important aspect, recovery. And recovery with athletes is superbly important.
100%. I actually agree with you on that.
Yeah.
Yeah. They don't give time for that.
Yeah.
And
time. And I mean, there's different ways to recover. I mean, with this specific patient, she said to me that, I know I didn't give a lot of time to stretching. And because I didn't stretch, I've got low back pain now. And I said, well, no, it's most probably your load.
Yeah.
Most probably the load is the problem. Yeah. The stretching is just one aspect to it. But I think the primary issue is you've just overloaded and you've now strained the area.
Yeah.
And this is why you have the issue.
But also we don't have the guidance, like people would give you proper guidance here about conditioning yourself to do that kind of sport, conditioning yourself to do that much of running or hiking. It takes a long time to condition your body to be able to handle that stress. Right?
Yeah.
And that's when your mind thinks, I can do this, but your body, cannot, and you're not aligned.
Yeah.
And I don't know what needs to be done for that to happen.
I'm going to say more science needs to be involved.
Right.
A lot more science needs to be involved. There's the concept of periodization.
Yes.
Okay.
Yeah.
How are athletes being looked after in a periodization table? Leading up to an event, for example, or through an injury where they've been injured and now they have to go onto the treatment table.
Yeah.
There's still a periodization program there to get them back. Let's just talk about football, for example. I was involved with one of the football clubs here in Bahrain.
Yes.
And what is the periodization plan there that you have to have for the patient? Of course, the coach doesn't like you because you taking his player off the field.
Yes.
Yeah. And
But
he
isn't
needs
that
the player.
good that you are working with him?
Yes. This is it.
Isn't
At
it?
the end of the day, we're working together.
Yeah.
Yeah. But of course, everyone always wants their best players on the field. Yeah. And that's again where the science comes into it. So sports science, involving sports science into how we manage players. I'm gonna talk about football. Pep Guardiola, he talks about the importance of his sports science department and rehab department in actually choosing his team. We often get frustrated that, our favorite player is being pulled off at the 60th minute mark when he isn't even the weakest player for that game. Somebody else has been weaker. Why is he taking our favorite player off? Well, actually, the science department, you can blame them because they've said to Pep, if you're going to play player X, you can only play him for 60 minutes. And then you've got to hook him. Not because he's playing poorly, but based on the amount that he's done at that time, he now increases his risk of injury.
Absolutely. But then you're talking about pro athletes, who have like structure and specialists.
What makes a pro athlete any different to the layperson? Why shouldn't we?
I think it's the help they get from their team.
Yeah, but
when it comes to doctors, to trainers,
the layperson get that.
I think also athletes need to be more educated, not only the coaches.
100%. Athletes need that education, and needs to come from obviously the hierarchy. Who was I talking to about this the other day? But I was saying, for example, Cristiano Ronaldo, one of the most valuable assets. Okay. He moved for big money to Saudi. He is an asset for them. And like any asset, you got to protect your asset. So I'm assuming, and I think a very positive assumption would be to say that one of the ways that a Saudi club would protect Cristiano Ronaldo would be by giving him the best evidence-based care, whether it's recovery, whether it's treatment, whether it's performance. Whatever it is, they are doing to protect their asset because they've thrown a lot of money to him. So in order for me to get value from him, I need to make sure he's playing. So if, for argument's sake, Cristiano Ronaldo is wearing a black shirt and the research team in Al Nassr has said, wearing a black shirt, please, this isn't true, but wearing a black shirt can protect you from an ACL injury, everyone should do that. And I always say the lay population should copy what professional athletes are doing. If a professional athlete is recovering or getting treatment in a certain way, the lay population should look at that because professional athletes are giving you free information here. Because again, by virtue of protecting the asset, they are saying, okay, the science shows we should do this. And the public is looking in on that. And well, that should be the latest research. So let's do that. So yes, athletes need to also be educated from the top to the bottom, which is, I think, something that has been going on recently. I know of a gentleman who's been in the UK. He's Bahraini. He's been in the UK and he's come through with a sports science degree and he's doing some fantastic work. And some of the stuff that I've seen him put out, brilliant. So I do see that in Bahrain. There are steps to that. But what I will say is, let's not always blame others. Let's also take some responsibility on
Yes.
ourselves.
Yeah.
And me as an athlete or me as a lay person also needs to understand I've got a responsibility with my health.
Yeah.
And I need to also look, investigate, understand, and question
Yeah.
whoever gives you advice.
Yeah. Absolutely.
Yeah.
That's why they should come to people like you and people who are professionals and know what they're doing. So now let's talk a little bit about people who have like office jobs and
hmm
general public, let's say. Uh, what do like people come to see for other than athletes, like general public and
hmm
let's say people who have an office job?
Yeah.
What's a common thing that you
Lower
see every day?
back pain. Yeah. Lower back pain, neck pain, shoulder pain are the three big ones that generally or the lay population struggle with. I think one of the problems that we have with medicine today is it's become superbly commercialized.
Right.
Now, when we talk about the office, for example, today I was asked, would I be interested in giving a chat on office ergonomics?
Hmm.
And I tapped my fingers. Ugh. Frustrated. Don't know if I want to do that. Why? Not that I have any issue talking. As you can see, I don't stop.
Yeah.
Yeah. My issue is what does that mean? Office ergonomics to try and help, an office worker. What does that actually mean? Because yes, 15 years ago, the idea was let's sit straight, shoulders back, head in line with the computer,
Yeah.
chairs at 90 degrees. And I was taught that in university as
Yeah.
well.
Yeah.
But that was 10 to 15 years ago.
Hmm.
The science has changed and evolved since then. What we've come to understand is that, I'm sorry to say this, because it's going to burst a few bubbles.
It's all
There's
right.
no
You can.
such thing as bad posture.
Yeah.
It's a lie. I'm sorry, it's a lie. There is no such thing as bad posture. Haifa, let me not ask you what's your age, but let's say this.
Yeah.
Can I say that you in your lifetime have seen 100,000 people, not just in person on TV, but in person or just crossing the road
Right.
in the mall? I think 100,000 is
Yeah.
fair.
Yeah.
Sure, you've seen a lot more than
Oh,
that,
yeah.
but
Yeah.
let's just say 100,000. Of that 100,000 people that you remember seeing, how many have you seen with perfect posture?
0. But then
hmm
I think everybody, let's say like talking about my clients, for example, or even myself,
hmm
I don't think there is a perfect posture. And according to what? My posture right now, I feel perfect.
Your posture.
Is my posture.
That's it.
Right. So even when it comes to training people with different postures, you have to train each one of them differently.
Individually.
Yes.
Yes.
You can't just copy and paste workouts. And that's what I see and pisses me off.
But copy paste works because it makes you money. You don't have to do work.
And also another thing is, well, let's not talk about training, but yeah, again.
Yeah. And I don't mind talking about therapy because unfortunately that's what you see.
Yeah.
Oh, okay, you've got bad posture, so we need to do
Yeah.
wall angels and thoracic mobility and chest stretching. Calm down, people. Calm down. I've been on here now chatting for a small while. I'm sure people who are watching here will notice I don't have perfect posture. I know for a fact my head tilts. Yeah. And I consciously think about bringing it back here.
Yeah.
But then I know, I get a little bit of a stretch there. Yeah. But
do you rather sit uncomfortable and be so uncomfortable, but then just to look perfect because now I have the perfect posture? And I've seen people wearing those belts that like straighten their backs, and I think it's stupid.
Horrendous. I'm not here for a photograph. I'm not here. I'm here for me, and I will sit as comfortably as I need to sit. And again, what is comfort? Comfort, I'm not sure if they'll get this on the video, but I can slouch like this comfortably for a small while before you and I know that this is going to become uncomfortable. And then I'm going to do a bit of this and then I'm going to feel uncomfortable here, and I'm going to shift back here. So what is comfortable? Because again, if I say to you, sit in what we consider a perfect postural position,
Right.
and let's watch a 2-hour movie.
Oh,
You reckon you're going to sit like this for 2
oh
hours?
no.
But why? You just said that this is the perfect postural position, or rather, I said that.
It is not perfect for me,
Yeah.
but
Oh, this is it. This is it.
I don't know who puts the rules.
There is no perfect
No.
posture.
No.
So when it comes down to, trying to give an ergonomic talk to, office workers,
Right.
it becomes a bit blurred, because what do you actually talk about? Yes, I can talk about ergonomically, for example, in an industrial setting. Yes, it's good to use hoists, and let's teach people how to use hoists instead of us having to have to heavy lift.
Yeah.
Fantastic ergonomic education. But for me to stand there and say, okay, ladies and gentlemen, I need you to please consider setting the computer screen at this position and sitting in that position. No, I'm literally wasting your time and my time, because I know I cannot sit in this position and work. What I will say will take 30 seconds as a postural talk. Guys, sit how you want comfortably. Just make sure roughly every 20 minutes, you get up, move, go grab a glass of water and sit down. You've changed your position.
Yeah.
That's it.
Yeah.
And constantly
Yeah.
look at changing your position.
Right.
Yeah. But trying to sit in this robotic postural picture that you see on the internet,
And the thing is,
craziness.
it is promoted a lot, and some doctors also talk about it. And this is how you should sit and how you should walk, ignoring differences and imbalances.
Yeah.
And
I call it lazy medicine. I call it lazy medicine, because you are still sticking to your dogmatic approach from the early 90s, the early 90s. That's what you're still sticking with.
yeah.
I mean, I still see people sticking with the Rice principle, rest, ice, compress,
Yeah.
elevate with an injury.
Yeah.
But the gentleman who actually invented or coined that term has come out and said he was wrong.
Yeah. They
Yeah.
still don't know, Dillon, so it's okay.
Yeah.
I mean,
But-
it's not okay, but
But
they
again,
don't know.
that's you talking from the lay population. I, as a medical practitioner, have an obligation to know better. That's why you pay me,
Right.
because I'm supposed to know better.
Yeah.
Otherwise, just go and use Google.
Yeah. True.
Yeah. It's my job to know better, and
Yeah.
I need to stick with the research. And I need to know, okay, that has now changed, and we have to now approach
Yeah.
the injury in a different way.
Yeah.
So, yeah, things have changed.
Yeah.
Things have changed.
I'll ask you a really, let's say, different question.
Mm-hmm.
When it comes to chiropractic adjustment, do they have any impact on the organs? Because, for example, when I personally did some work, I felt I can breathe better.
Okay, fair enough. So, thank you for helping me answer the question. Yeah. There is no science to show that a chiropractic adjustment has a direct impact
Right.
on organs. There is no research to show that.
Yeah.
Or at least no high quality, peer reviewed research to show that.
Right.
But like you just said, I felt I could breathe better. Yes. Why? Because with the adjustment, we now mobilizing joints. So when, for example, we do the adjustments to your spine, specifically your thoracic spine or your upper back, we mobilize those joints. So now when you take a breath in, instead of, if you can imagine, this is in the back,
Right.
where the joints are stiff and tight like this, and you breathe, it's not moving. Okay.
Yes.
But when we adjust and mobilize, now when you breathe, it goes,
Right.
ooh, I can breathe easier.
Yes.
I haven't adjusted to affect an organ. I've adjusted to affect the joints,
Right.
which has a secondary effect of
Yeah.
allowing better movement of the chest cavity,
Right.
which then allows and enhances my breathing.
That's amazing.
Yeah. But in terms of, I know there was a chiropractor in South Africa who used to go on about, if I adjust a specific level in your cervical spine, in your neck, we can affect your diabetes.
Oh.
What? What? Ethically, that is so wrong.
Yeah.
That is so wrong. Don't say that. So there's a direct and an indirect influence.
Right.
So yes, indirectly we could, but directly, no. There is no evidence or science to show that that is the case.
When it comes to, for example, physiotherapists, again, the physiotherapist question just popped, sorry. Usually they'll ask for MRI or X-ray. Do you do the same thing? Would you ask? And in what case you think it's necessary to ask?
It was interesting when I moved here, because the access to MRIs and imaging here in Bahrain specifically, it's quite easy. It's I'm not saying it's cheap, but it is a lot more affordable here than it is in other countries. For example, for me in South Africa, it's rather expensive to get an MRI done. Here, not a problem. Based on that, it seems that it's given out very regularly, which I don't necessarily agree with. And again, the research actually shows that from a psychological standpoint, once a patient gets certain imaging, an idea is now placed in their head. I personally can't request for an MRI. If I feel a patient needs an MRI and X-ray, I will have to go and refer the patient to an orthopedic doctor who can then request based on my observation. Or maybe they might deny it, saying, no, we disagree and we don't approve the request. I need to be very careful in the way in which I actually go about describing this. MRIs are fantastic diagnostic tools to try and help understand what's going on. But if you, as just the layperson, opens up your CD with the MRI image on it, I'm going to say all, but let's just say 99% of CDs, it'll open up and say, this is not intended for diagnostic purposes.
Oh.
Open up an MRI CD. That's the first thing that'll come up. This has not been intended for diagnostic purposes. So why are we doing it? Isn't that the idea?
Since you said that, I'm never doing it. Again, I don't need to do what I want.
What I will say is that they are fantastic and needed for a lot of situations. But there's also a lot of situations it's not needed. Because I'm having neck pain and I can feel it going down my arm, the idea is he or she must have a disc issue. Well, there's other reasons why. Okay. And then we go get an MRI and it shows he or she has a disc. So that must be the cause. No, that doesn't mean it's the cause. If you look at the research in the 30 to 40 year bracket, they took a group of 30 to 40 year olds and they made sure all the individuals in that group did not have neck or back pain. They then said, all of you go and get an MRI done. 50% of those people walked out with disc injuries on their MRI. But they said they had no pain. How is that? So can we really relate disc injuries to all neck pain that goes down the arm or all back pain that goes down the leg? Surely not. Surely not. Maybe it's a norm. Like, I'm getting a bit older. You can see the gray in my hair. Well, if this can age and these bags develop with age, why can't my spine degenerate.
Right.
Just like this is degenerated, why can't my spine? My spine can degenerate.
Right.
And that's what we call degenerative joint disorder. Yeah. Or disc injury. Yeah.
It's easier to say disc injury.
Yeah. Yeah.
It's much easier.
Yeah.
And
So-
it makes more sense.
Yeah.
Honestly, to majority.
Yeah.
Yeah.
So the thing is, we know it's gonna happen at some stage.
Yeah.
So if I am in the 30 to 40-year-old group, and there's a 50% chance of me having it anyway,
Right.
how can we definitively say that that is the cause of this?
Yeah.
No. Let's look at other causes. But again, let's say, yes, we did the MRI, 100% the disc is the cause of it. Well, now we need to consider, well, what caused the disc injury?
Yeah.
Yeah. Well, age could be a telling part. Trauma. I got into a motor vehicle accident.
Right.
There goes the neck into a whiplash.
Yeah.
Can cause further injury to the disc.
Right.
Traumatic injury to the disc. And now I've got disc impingement on the nerve. Okay. In essence, all it is compressive features.
Yes.
So how about we look at naturally decompressing? And one of the well-known documented ways of decompressing a disc is strength training.
100%.
Yeah. Increase the muscle tone and capacity
Yes.
of supporting structures, and you could, in very good time, reduce your symptoms of disc injury
Yes.
by decompressing.
Yes.
Yeah. It's well documented.
Yeah.
It's well documented
Yeah.
that strength training, deadlifting with a disc, heavy back squatting with a disc is pro. Yeah. It shouldn't be stopped.
Yeah.
Yeah. Especially if you have experience lifting, you should be doing it.
You know, it's funny because not so many doctors say this. They'll always say be careful and avoid deadlifts and
Mhm.
avoid squats and
Yes.
and you know there are alternatives, but then why not just do them if you can? And if you can do them in the right way, the right posture, right form.
Well, again, I'm going to try and sit on the professional fence here and say I do understand the train of thought, which is don't do it because you might aggravate it from certain because of certain factors.
Yeah.
But the deadlift itself
Yeah.
is not going to make it worse.
Yeah.
The deadlift itself is actually going to improve because it's going to cause tissue remodeling.
100%.
It's going to cause the bone itself to remodel and strengthen.
Yeah.
So it actually improves function.
Yeah. Yeah. So, you know, like I've seen also videos of you training your patients. Like
Mhm.
you were doing some probably corrective exercise or strength exercises. And I haven't seen many chiropractors doing them.
Yeah, yeah.
And does it help with? I'm sure it does, but then it's different. It's not.
Mhm.
It's not
It's different.
common.
Yeah, it's different. It's a different approach. It's a different way of looking at things.
Right.
Again, you've gone to chiropractor A, who's done the clicking, and has it helped you? Yes, continue. It hasn't helped you. Why are you coming to me expecting me to click any different?
Yeah.
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 Let me do something different. Yeah?
Right.
And let's change your plan.
Mm.
Or you've gone to physiotherapist ABC,
Mm.
and they've done soft tissue work, electrotherapies. Yeah.
Yeah.
Do you think my machines are better? Well, let's do something different. Yeah. It's always about changing.
Right.
Improvising. When I incorporate the strength and conditioning, when I incorporate the more efficient movement patterns, it's just to rehab the patient to get them to a point where their muscle capacity is at a certain level,
Right.
but their demand is at this level.
Yes.
So
Usually, yeah.
we need to change their capacity or we change their demand. Now it's up to you as the patient to know what is modifiable. Can we change your demand? You are an athlete. You need to be at this level. So we can't change your demand.
Right.
So we need to change your capacity. And by doing the rehab component, we're trying to modify here. Yes, the education, we can maybe modify the demand. So we try and find that equilibrium, or maybe a little bit more, but then you aren't pushing your athlete enough. And that in itself can increase a risk of injury.
That's fantastic, actually.
So you need to find that very fine line equilibrium. And this is where the sports science becomes a huge factor. And understanding that has a big influence on athlete performance, on risk profiling. I believe in baseline testing. Baseline testing should be done on all athletes. And when I talk about baseline testing, I talk about muscle strength testing. Should be done. Just similarly to the way you and I, for example, every year should go for our blood medicals. Everyone should be going for blood medicals from the time you're 25. Every year, get a measurement so we can see where your baseline is. So eventually,
and that will also help them as athletes to get better.
Yes, 100%. I used this example the other day trying to explain to a patient. Let's say, for example, a certain test marker should be at the level 5.0. We do a blood test on you, and the average is 5.0. But for you, your level was 5.5. Is that good or bad? Okay. It's above average. So in theory, it's bad. Yeah. Is it bad? The reason I ask is because in the last 6 months, you've edited your diet and it's now at 5.5. 2 years ago, it was at 7. So you have a downward trajectory that you can measure. It's objective measurement. You can see that. So now all of a sudden, 5.5 is fantastic compared to the 7 that you were. And you're on a downward trajectory, which means you are getting in a better position. The same way I can say if your measure was 4.8 and average is 5, is that good or bad? Again, theory, that's good. But a year ago, it was 3.
Right.
Now it's 4.8.
Yeah.
That's not good. That's not good. Even though it's good, it's not good. By building a year-to-year baseline measurement, we can track what's going on in your blood levels. So the same way we do that in blood levels for the layperson, athletes can get that done for their muscles. We can do isokinetic testing. There are facilities that do it. I brought that to Bahrain from a private situation, in a private clinical setting. You can get that done.
I didn't even know that we have it here. Until you told me that.
I was the first one to introduce it in Bahrain at one of the clinics that I was working at. And this is something that should be done. For example, if you're an athlete, you're a football player, should be done preseason, should be done mid-season, should be done post-season. Getting baseline measurements, tracking what's going on with your muscle strength. Why is your muscle strength decreasing? Oh, maybe this player is either carrying an injury or he's been overloaded. Okay, coach, you need to give him a break. Reduce his minutes, reduce his training, give him extra recovery. We can now measure and improve performance of our athletes.
Which makes their lives easier. And
easier but harder. But
but then the outcome will be much better then, right?
That's the thing, the outcomes.
So can chiropractic adjustments enhance muscle strength?
Again, I think it's similar to the organ question.
Right. So
Yeah.
indirectly, it can.
Indirectly, yes, because if you are struggling with a lower back injury
Right.
based on your movement and we can help
Yeah.
that movement,
Yeah.
maybe you can squat deeper.
Mm.
Maybe you can plyometrically explode
Yeah.
stronger, improve your performance.
Yeah.
Yeah. We can indirectly
Yeah.
assist with that.
Yeah.
So yeah.
That's amazing. Maybe I should come see you then.
Of course. Yeah.
Let's say flexibility versus mobility. Which one is more
King.
important?
Yeah.
It's the question. Huh?
Oof, flexibility and mobility. I'm gonna put it down to demands. Demands. What is flexibility? What is mobility? For example, a gymnast has incredible flexibility. Does that mean that they are better off than me, a potato? Yeah. I know a lot of gymnasts are prone to what we call a retroanterolisthesis or spondylolisthesis, which is slippage of the spine, because the little facet joints, they actually break because of that increased flexibility of their spine.
Right.
Yeah. But yeah, do we then say, okay, well, flexibility is then bad? No. It's based on your demands. You as a gymnast can't afford to have limited flexibility. But you as an office worker can have reduced flexibility. Yeah. I think mobility is important. I think mobility is vital. We need to be mobile. But just slightly off topic here, if you don't mind me talking about like the stretching part for flexibility.
Yes.
So there was a study that was done where they'd taken 100 individuals per group. So in group A, let's call it group A, they said, you guys, we don't want you to do any strength training. All we want you to do is stretching for X amount of time.
Right.
That's it, just stretch.
Yeah.
They measured the flexibility of the patients. Each patient, so Haifa could get X amount of flexibility in a hamstring stretch. They then gave her a period of time of flexibility stretching and remeasured her. So let's just, for argument's sake, give it a number. There was a 10% increase in her flexibility. Fantastic. We've got an increase in flexibility. They then took another group of 100 patients and said to them, we don't want you to do any stretching. Zero.
Right.
All we want you to do is strength train. Okay. Obviously, a similar body part. So, for example, hamstrings. They then did a baseline measurement, and where you could get 10 centimeters, this patient could get maybe 5 centimeters. Yeah. They then made all those patients then do their strength training for the same period as the stretching.
Right. Yeah.
At the end, they then looked at the results. Strength training gave the exact same improvement in flexibility as stretching.
Very impressive.
What that showed was there is no difference between strength training and stretching to improve flexibility. But if you're going to spend, I think it was 8 weeks on stretching or strength training, and you can choose between, they recommended the strength training. Because it increased your flexibility by the same value, but also gave you strength.
That's amazing.
Whereas flexibility, all it did was give you flexibility in your stretching. Yeah? Or sorry, stretching in your flexibility. You know what I mean?
Yeah. But it's just, it's probably will be very confusing for a lot of audience, because So many doctors will say you must stretch and it's more important than going to the gym. And no, it's not.
Show me the research. Show me the research.
You are
where-
talking about research and you're talking about valid research.
Yeah.
And I don't think anybody's looking at that, unfortunately.
Yeah. There is no research to show that
Yeah.
Stretching is more effective
Yeah.
than strength training. If anything, it's the other way around.
Yeah. What is the most common mistake that gym goers make at the gym, of course, that leads to injury? That's very common. I don't know if I put the question.
Yeah, no. I get you. I get you. You know what's a common? Yeah. I don't know the stats on that. Okay,
Yeah.
but what I can tell you from personal experience is, unfortunately, the underload overload
Yes.
issue. Yeah, the recovery aspect.
Yes.
These are the two vital ones that athletes or clients are struggling with, is understanding what I call dosage of exercise.
Yeah.
Yeah. Exercise prescription. Yeah. I think that there is limited knowledge that's out there. Sorry, I shouldn't say out there. Actually, the knowledge is there. I'll say the application.
Yes.
Yeah. It's limited application of the research that's out there. Yeah. Because again, everyone wants to be a gym bro.
100%.
Yeah, everyone wants to be a gym bro.
Yeah.
And you know, I've seen Haifa do ABC. I'm gonna do ABC.
Yeah.
Yeah. But again, genetically, Haifa is completely different to me. Physically, Haifa is completely different to me. Mentally, Haifa is different to me. How we go about actually training is and should be super individualized. Plans cannot be cookie cutter.
Right.
Yeah. And again, you see a lot of cookie cutter.
Yes.
A lot of cookie cutter
Yes.
when it comes to these sort of things. And I think improving load in terms of not just always increasing. I mean, again, you understand this. There's ways in which we can
Increase intensity.
Yeah. We can stimulate. We can increase rep.
Yes, absolutely.
We can increase set.
Yes.
We can increase weight. And we can increase time under tension.
Yes.
Yeah. So these are 4 variables that we can play with to change a client. Yeah. But for most of us, I'll just lift heavier.
Yeah.
No, you don't have to lift heavier. Yeah. You can change any of the other 3 variables and you're still giving that muscle a stimulus.
Absolutely. Yeah. You know, like sticking to basics is what I find works all the time. And even if you do like a basic exercise, for example, and modify, for example, the weight, just the weight, just the reps, even if you keep the weight the same, the muscle responds.
Yes, it does. It does. That's science fact.
But then I think coming out from you as a doctor, people will just listen because you are giving them the right advice, you know, and showing them also evidence.
That's the thing.
You know,
I'm not speaking from opinion.
Yeah.
This isn't my opinion.
And when they come to you with injuries and you explain this to them, it makes more sense because in the first place, they made these mistakes and they ended up, for example, injuring themselves.
Yeah. Again, this isn't opinion based.
Right.
This is fact based.
Right.
Fact backed by research.
Yes.
Not research that I've done.
Yeah.
Independent research.
Yes.
That research is out there for anyone to see if they want.
Yeah.
Yeah. And you go about just looking. What are the facts?
Yeah.
These are the facts.
Yeah.
We don't have to continuously overload just by weight.
Right.
And you know this.
Oh yeah, absolutely.
Just hold a 5-kilogram dumbbell in this position for 20 minutes.
Yes.
That's not possible. Yeah. Yeah, I shouldn't say it's not possible. Someone's going to hold me to that. But But it becomes difficult.
Yeah.
But I haven't done one rep.
Yeah.
I've just held that.
Yeah.
For 20 minutes.
Yes.
It becomes incredibly difficult.
Yeah.
So yeah. And then of course, like I said, the recovery aspect, part that people understand culture. But here in the Middle East and in Bahrain, of course, there is a certain culture here,
Yes.
just like we have a South African culture.
Yes.
And of course, here, there's a lot of late nights involved.
Yes.
Yeah. What is your quality of sleep? Yeah. The quality of sleep, not the quantity. Yeah. If we look at a recovery pyramid, the base of the recovery pyramid is based on sleep. That is the time your body makes use of nutrients, which is your next step on your pyramid.
Yes.
Even if your nutrition is fantastic, there is no point in having that fantastic without the base layer, which is your sleep.
Right.
Because your body uses those nutrients through sleep, which is when your recovery takes place. So that's one of the big lacking areas, is the quality of sleep that patients and clients are not evolving.
Yeah.
Yeah. It's still, well,
Yeah.
I had enough. I'll cover up on the weekend.
Yeah.
You know.
Oh, the weekend.
Yeah.
That's what everybody says. I'm gonna,
Yeah.
I'll just wait till the weekend till I fix my sleep. And it never happens in most of the cases. Yeah. And speaking about like nutrition, as we know, nutrition has a massive impact on performance, sports performance, on speed, on strength. Does it have the same impact on, let's say, healing from like an injury, for example? Does it have the same impact? Do you see that? Do you see that it makes a huge difference when it comes to, like, for example, with your patients? I'm not talking about athletes only now.
So yes, 100%.
Yeah.
What you're putting into your body is what's going to be utilized to help you. If you are putting in tons of sugar, for example, how our body utilizes that and what it actually needs and how much it needs for an injury. So I've just had surgery on my knee. Yeah. My body needs to recover. My body needs to heal. Throwing sugar at that isn't. It's going to, in actual fact, increase inflammatory markers.
Yes.
Yeah. Slowing down the process of healing. So what we put into our body is also superbly important in terms of recovery from injury for an athlete or for a layperson. Yeah. If I'm struggling with neck pain or lower back pain, eating certain types of food can increase inflammatory markers. Yeah. Which again slows down the process. Please, when I say that, you gotta also understand inflammation is good. Yeah. People think inflammation is bad. Inflammation is actually necessary for the body to heal.
Yeah.
But there's certain amounts of inflammation that's necessary.
Yeah.
Now, we having a lot of sugars, just for example, and yes, sugars are that evil. But having sugars just overloads the inflammatory markers and can then slow down processes. Then we can eat foods highly rich in antioxidants, which can then help the recovery process. So again, yes, nutrition is superbly important, whether it's for the layperson with low back pain and neck pain, or for the athlete who's training, not even an injury, an athlete who's training superbly hard to compete in the next Mr. Olympia. Their recovery process and their nutrition and diet helps them recover quicker and can possibly give them that small difference between first place and second place.
Yes.
And everyone knows there is an absolutely minute difference between first and second.
Yes. Dr. Dillon, you know how people replace their meals with like supplements or meal replacements. And I'm sure you see this a lot because I actually do.
Mhm.
And when sometimes it's really necessary to do that. Like
Yes,
I don't
yeah.
have time to eat, I need to do to have a meal replacement. And what's your view on supplements, especially that you can buy them anywhere now,
Yeah,
even if you
yeah.
don't need them, and there are supplements that will give you strength, like let's say 300 types of them that will give you strength, 10 types that are like fat burners, for example. And I'm sure you have a lot of patients who would ask you,
Mhm. You know, one of my gripes is the supplement industry. Yeah, because there's some definite pros, but also a whole bunch of negatives. Maybe if we look at the average person who's taking a supplement, why are they taking it? If we look at a bell graph, okay, a bell graph looks at the average, yeah, where the average person is here. Most people are always looking at these aspects here, which is the extreme bad or the
yes,
extreme good. No, we should be looking here at the average. Yeah. So, can I mention names like celebrity names here?
yes, yes, yes,
Ronnie
yes,
Coleman.
right.
I see Ronnie Coleman doing A, B, C, D. So I'm gonna do like Ronnie Coleman.
Oh yeah,
Yeah. In terms of what we're putting into our body.
yeah,
Yeah. Are you at the level to do as Ronnie Coleman? Yeah. In terms of what we put into our body. This can be on any level, what we put into our body. We need to look and compare to our average. Yeah.
right.
And work from there. So when we taking a supplement, why are you skipping a meal to take either a meal replacement formula or protein shake? Oh, because I saw Ronnie does 8 meals a day, so I'm going to do 8 meals a day. Are you training like Ronnie? No. So why are you eating like him? Yeah. If you train like him, yes, eat like him, 100%. Yeah. But we're going to have a problem if you're going to do that.
Yeah,
Your kidneys are going to get absolutely trashed
right.
from doing that. Just a complete overload. Yeah. And it's important we understand again. If I talk about sorry, when I talked about understanding our baseline measurements,
Yes,
understand your baseline and work from there. There's a certain very controversial topic that I don't think we'll get into, but um, for me, get your baseline measurements.
yeah,
Get your baseline measurements and then understand whether this works for you or doesn't work for you. Don't copy this person and that person when it comes to those certain aspects,
mm,
aspects that can have a negative impact.
yeah,
Earlier on, I spoke about we look at athletes and we should train like them. Yeah, we should get treatments like them. Yeah, because those don't have a negative aspect.
yeah,
Yeah, we look at, for example, like I said, Cristiano Ronaldo, who is on this end of the spectrum. Yeah, we want to get treatment like him. Yeah, because it's medical treatment that has very little side
right,
effects,
right.
if even if it is overdosed.
Yeah,
In terms of we doing too many hot cold
yeah,
therapies,
yeah.
we're doing too many ultrasound. There's very limited negative side effect.
And
Yeah,
the pre-workouts, right?
yeah, yeah, yeah.
They kind of give you a lot of energy, you know.
Just a little. Yeah, just a little.
But
Yeah.
who takes one scoop? Everybody takes two instead of
What
one.
about I don't mix it just into my mouth.
Have you
Yeah.
seen that? Okay, so if somebody who is just like a beginner would go to the gym and with so much
Slow down.
energy, right?
Yeah,
And
yeah.
then we'll try to lift something heavy, and then you know what
Yeah,
happens
slow
next.
down. And again, I think this comes back to prescription,
Yeah,
you know, whether it's exercise prescription, because again, professionals exist because we've been there, we've done it, yeah, or we've studied and we know it, yeah. But if you're just going to apply it because I can apply it, maybe it might be a bit of a negative impact on your actual outcome.
mm,
Yeah. So that person who's just taking a pre-workout and then going and trying to do A, B, C, D, maybe you are increasing your risk for injury.
Right, 100%.
Yeah. Yeah. There's a good chance that you're probably increasing your risk. Yeah.
Thank you, Dr. Dillon, for being here. Thank you
It's my
for
pleasure.
all the information that you're giving us today. And I'm sure whoever listens to this will get at least one positive thing. If they are too
Hopefully.
negative.
Yeah,
If they're
hopefully.
not,
Yeah.
then each question that's been asked, they'll actually find it very beneficial too.
Yeah. No, I appreciate you guys having me here. It's actually been fun and fantastic. I actually really enjoyed this. I enjoyed talking. So this has given me an avenue to just continue with that.
Right.
So thank you very much. You can find me on Instagram at Dr. Dillon Cuppusamy, chiropractor.